Governor Newsom is giving a news conference right now. Let's listen in.
Our own personal responsibility as it relates to mitigating the spread of this disease. It is incumbent upon all of us to recognize what is self-evident, and that is that it is our decisions, not our conditions, our decisions that will determine our fate and future as it relates to the spread of this virus. It's our decisions that will determine how quickly our children go back to school. It is our decisions that will determine what kind of activities we get to once again enjoy with our friends and family. And of course, it's our decisions, personal and sum total of all of our decisions, that will determine how quickly our business sector can reopen with some semblance of the way things used to be. It's important to remind all of us that this transmission can be substantially mitigated by wearing face coverings, by wearing face masks. This slide we present is pretty self-evident, and I think the evidence is overwhelming. We've seen in other countries as it relates to the importance and potency of wearing face coverings to mitigate the spread of this disease. Recommendations now from the CDC clarifying that point of view, and clearly now an increasing number of people that are taking the personal responsibility not only to protect themselves but to protect others. And I just want to thank all of you that are doing that, for practicing the kind of behavior that will allow us to move past this pandemic sooner than we otherwise would. The issue of going outdoors and taking activities specifically that traditionally have been indoors and now moving them outdoors, obviously also to the extent airflow is a big part of that, can mitigate the spread of the virus as well. And that's why we talk often, not just about masks, but the importance of moving indoor activities outdoors. Accordingly, we talk about physical distancing, social distancing. Some refer to it physical distancing, just being 6 feet apart from people you otherwise do not mix with, people that are outside of your household, people that you come close contact with when you're out doing the essential day-to-day work that we all need to do. Fewer people you mix with, the significant reduction in the likelihood of seeing others contract the disease, and of course you as well being impacted by this disease. This next slide bears, I think, some consideration and reflection. I put this slide up a few months ago, worth putting back up today. The power of exponentials, this notion that just an individual that is positive, that comes into contact over a 5-day period with just 2.5 people. Within 30 days, those 2.5 people start mixing with others, and now you have over 400 people that have come down positive with COVID-19. You see just a significant, or rather modest by some people's estimates, but significant in terms of its impact, reduction in the number of people you've been exposed to. You just cut that in half from 2.5 people to 1.5 people. Now you're only impacting over a 30-day period through the power of those contacts 15 people, and less still if you reduce your exposure to less than one individual. And so the point is, we have to minimize our mixing. We have to minimize the transmission of this disease. We have to minimize that by practicing physical distancing, wearing the face coverings, and doing the kinds of things that I think are well described and obviously now need to be more vigilantly followed if we're going to move past this more expeditiously. Last week, on Monday, I put out this new dimmer actions that we're taking in the state of California and what we've done statewide. We talked about those counties that are on the monitoring list, 33 counties, and I'll give you an update on those county lists here in a moment. Again, focusing on indoor operations, on gyms and fitness centers, places of worship, still allowing activity to occur outdoors. Accordingly, issues of barber shops and personal care services. I want to just make personal clarification on the issue of personal services. This was the slide we put up a week ago relating to indoor activity. It was our intention to provide for for barbershops and the likes to be able to do their work outdoors. Turned out that was more challenging than it may have appeared. The good news is we now have new guidelines out on the COVID-19.ca.gov website, COVID-19.ca.gov website, clarifying what we can and can't do as it relates to haircuts and activities that we want to move indoors, outdoors for personal care service industry. Turns out, without getting into too many details, but issues of chemicals and shampoos and perms, it was more complicated than some had considered, particularly as it relates to local ordinances and rules and regulations that were in place. So we worked through that over the last number of days, and those new guidelines are up, and hopefully that provides some more clarity. If we need to provide even more, we'll get the good feedback, which I anticipate from the new guidelines we put up. But rest assured, the intention was to provide those activities with conditions outdoors, no longer indoors. Here's why. Again, we're seeing an increase in our 7-day average, total number of COVID-19 positive cases. Yesterday, July 19th, 6,846 positive cases. 7-day average, you see up there, 8,911. We take a closer look at our positivity rates, number of people tested, number of people that test positive, becomes a positivity rate, with now record 7-day average of daily tests, over 124,000 daily tests on average over 7 days. By the way, 127,000 tests yesterday. Our positivity rate over a 14-day period is holding at 7.4%. This time last week, it was at 7.4%. Our 7-day positivity average last week was at 7.7. When I announced on Monday, it's now at 7.2%. So 14 days holding at 7.4. Our 7-day dropping from 7.7 over a week ago to 7.2. Let's get under the hood, as we tend to do here, and look at the numbers a little bit more closely. That 7.4% rounded up. You see 7.39% positivity rate over a 14-day period. This represents about a 9.2% increase over a 14-day period. So you saw a big increase, and now we're seeing some stabilization. But again, no one is satisfied being north of 7%, and we got close to 8% last week. So these numbers can change very, very quickly, again, depending on our personal behavior, sum total of which will determine the direction of the lines on this graph and ultimately the direction of our ability to reopen this economy and get our schools back open, as all of us so desperately look forward to. As it relates to hospitalizations, we've seen a 16% increase in hospitalizations over a 14-day period. By the way, that is an increase, but it is a decline in the increase we've experienced over a 3-week period. Let me, without confusing you more, be more specifically. 2 weeks ago, we put up on Monday our hospitalization numbers. It said we were increasing over a 2-week period by 50%. Last week, Monday, over a 2-week period, we were increasing by 28%. This week, over a 2-week period, we're increasing by 16. So 50, 28 to 16. That's an encouraging sign, but I will enliven you with some additional thoughts in a moment as we walk through not just hospitalizations, but ICUs, and then start breaking things down by county. Remember, these numbers are statewide, in the aggregate in our state. None of us live in the aggregate. All of us live somewhere in the state, and there's a very different picture that you can paint depending on where you are in the state that is not painted by this chart. That said, again, it is encouraging to go from 50, 28 to 16%, but we want to see a decline, not a reduction in the rate of growth. Total population of individuals currently in our healthcare, about 9% are identified as COVID positive, which is about where we left the week last week, often Monday, roughly 9%. Traveling anywhere where numbers are are anywhere from 8 to 9% consistently over the last few weeks. But we're moving in a direction again where we're seeing pressure on the hospital system. Will impact that more in terms of where, but total hospitalizations with COVID-19 patients represents 9% of the available hospital beds within our healthcare system capacity. ICUs, again, hospitalization numbers go up. Invariably, you'll see ICU admission increases as well. Not dissimilar to the hospitalizations. 2 weeks ago, we announced 50% on the hospitalization increase over a 14-day period. 2 weeks ago, I announced a 39% increase in ICU admissions. Last Monday, it was a 20% increase in ICU admissions over a 14-day period. Today, you'll see that slide, 12% increase in ICU admissions over a 14-day period. So not surprising. Hospitalizations, ICUs, tracking, but lagging indicators, one another. We are seeing a reduction in the rate of growth, but a rate of growth nonetheless, which only reinforces the seriousness of this moment and the importance of taking the personal responsibility we all must to practice the physical distancing, do our activities outdoors as much as we can, and obviously wear face coverings. So that gives you a sense of where we are in ICU admissions. Let's get closer to what our total capacity is within our critical care system. You'll see there that chart, about 17% of the ICU capacity, and that includes ICUs and NICUs. And that number, those are for younger people. That number, 17%, has been in the 15 to 17 range over the last few weeks. So total system, we feel like there's more of the orange you see on the chart than the blue. But again, certain parts of the state, this is absolutely not the case. You can reverse those colors and you'll see real constraint in ICU capacity. I'll be specific in Placer County today, just 18.6% of their ICU beds are available. There's parts of the state, it's even less still. San Benito, 0%. The ICU capacity available in that county. Again, an indication, county by county, that things look very differently than they do system-wide or statewide. And that's why it's so important to go back to this list, this monitoring list. Here are the 33 counties. This is the total number of counties that are on the monitoring list in the state. San Francisco did come on the county, which we had anticipated, announced that likely to happen Friday, did. And we are currently monitoring with very close technical assistance provided. These 33 out of our 58 counties in particular because of a number of issues related to criteria they set forth where we're not seeing things necessarily improve in all those critical areas. And so, again, this is a list that we are laser focused on. This list represents the overwhelming majority of the population in the state of California. This is a list where if you reside in these counties, we just only reinforce and underscore the urgency of the individual activities in terms of modifying our activities to help us mitigate the spread. In many of these counties, and I highlighted Placer County, Napa County, and others, we are seeing constraints in ICUs. A number of these counties more challenging as it relates to hospitals. And that's not just beds, that's individuals staffing the beds. A lot of parts of the state now where we are seeing an exhausted frontline staff of credible doctors and nurses and nurse practitioners that are being stretched, and we are helping to provide some semblance of support, including the support we received last week. I want to thank the Vice President for that support. 190 individuals, medical team came from federal HHS to help relieve some of that stress. So that is indeed top of mind in terms of where we are in certain counties, San Joaquin, Stanislaus in particular, that we have have been monitoring very, very closely as it relates to hospitalizations, ICUs, and the issue of human capital, meaning personnel that need a break, that need to be supplemented, need to be supported. As always, I end these presentations, as I often begin them, by encouraging you to wear these masks as we did today. Once again, encouraging you to practice the physical distancing, wash your hands, sanitation, always top of mind, and one of the most potent things you can do to minimize the transmission of this disease, and then minimize mixing large crowds of all types, and encourage you to continue to take seriously and take vigilant and be as vigilant as possible to work through the next few critical weeks in terms of the pandemic here in the state of California. And just close with one additional comment, and that is we had a relatively low and, again, devastating number, 9 deaths yesterday, but relatively low in terms of numbers we've seen in the past, devastating for those families that were directly impacted in loss of a loved one. And our heart goes out to each and every family. And again, a reminder of how deadly this disease is as well. But I've said this in the past, when you've seen numbers go up, you've seen numbers go down, best to look at these trend lines over a 7-day period. And while the numbers were low yesterday comparatively, we've averaged 91 deaths over a 7-day period in the States. A little better than the 102 deaths tragically losing the week prior, but 7-day average tragically is 91. Just on Saturday, we lost 90 individuals. Sunday reported in 9 individuals. So I want people to be cautious about running with that news as somehow that's a trend or should be a headline, when in fact we should be very sober about the loss of an average of 91 human beings over the course of the last 7 days. So look, we want to continue to do more on testing. We're going to continue to ramp up those efforts, and I'm pleased that we're seeing an increase in the total average number of daily tests in this state. We're going to do more that we can to get that positivity rate to start trending down, not just try to mitigate its growth. Hospitalizations and ICUs continue to be a cause of concern in this state, and that's why we want everybody to double down on everything we have been doing so that we can get back to school, get back to work in the traditional ways, not just these modified ways with distance learning and modifications that make work activities more challenging, certainly, than they were pre-pandemic. So that's the update for today. And, of course, here to answer any questions, here as well with Dr. Ghaly, who's more than happy to answer questions as well.
Alexei Kozub, SF Chronicle.
Hi, Governor. I wanted to ask you about President Trump's comments today that he's interested in sending federal troops potentially into Oakland. Has the administration given you any heads up that they plan to send a Homeland Security agent to Oakland or any other California city? And if they did, what would your response be?
Yeah, the answer is no, and we'd reject it.
Ahmed Dickerson, Fox 40.
Hi, Governor. Thanks for taking my question. With respect to schools, you laid out the criteria last week for schools to be able to not just be open in person, but stay open in person. Given that that depends a lot on the situation on the ground, and to avoid a situation where schools are having to open up and close down and a lot of confusion, is the recommendation at this point, would it be better if schools just consider, if they're consistently on this list, just to plan not to open in the fall? And additionally, when it comes to testing with respect to schools and overall, do we have an idea of when we might be able to see a little bit more of the supply come through the pipeline? Dr. Ghaly talked about more of an availability of those tests coming through schools and in the community, but when will we actually see more of an availability of tests, not just of testing sites?
Right. No, I appreciate that. And as you know, we provided a minimum of 2 months, and we'll continue to provide PPE of all types, not just masks, face coverings, face shields, sanitation, sanitizers, and other sanitation equipment to the schools. We'll continue to provide them as needed basis. And as you know, we have this testing strategy where we'll cohort individuals on a consistent basis and test staff. Look, as more testing capacity comes into play, more testing will be made available. And so I can assure you the reason we announced a new testing task force, the reason we reconstituted a new focus a week ago, Dr. Ghaly making that presentation last Tuesday, was to intensify our areas of focus, and that would include our schools as well. And so we're very aggressive in this space. We're working overtime to make sure that we're being as creative as possible, and we've made a number of announcements, not just Dr. Ghaly, but myself as well, about how to start paying for these tests and what our expectations are in terms of the health plans and the like. We continue to work to provide more capacity, not only within our labs, Quest and Elcor, but also with our universities and our community partners. I should note the CDC finally came through with the testing, the pooled testing strategy that's well known in testing fields. Blood Bank's been using it for years and years. That allows more individuals to be tested. You pool those samples together. They provided up to 4 of those samples to be collected. In some cases, you'll see it well in excess. We've been waiting for those guidelines to come down. I think that's going to open up the opportunity to see more testing along those lines. It's beneficial in one respect, that if everybody comes out negative, everybody goes on their way, but it just takes a positive to come in there, then everybody has to be retested again. But nonetheless, this is again, strategy that has been utilized in other parts of the world, and finally we are able to move forward more aggressively here in the state of California. As it relates to the question specifically you asked about preparing for the rest of the fall, I'm not of that fatalist opinion in this respect. As I said in the outset, it's our decisions, not conditions, that determine that fate and future. I've said this on many occasions. Forgive me once again. I'll repeat it. Future is not something to experience. It's something to manifest. It's inside us, not in front of us, meaning we have agency. We can shape this conversation. We can shape the future by our specific decisions. And that is my hope and intention, is that we bend the curve as we did the first time in this pandemic, and we do it again as we're dealing with this flare-up still in the first wave of this pandemic. And so if we can do that, we can get our kids back to school. I have 4 kids. I'm saying this as a parent, as well as Governor of California. That's my hope, my intention. And so I don't want people to just believe that somehow we can't shape that future and somehow we're going to roll in over 3 or 4 months and someone else has written this script for us. This script has not been written. We have the ability to write it.
Marinucci, Politico.
Hi, Governor. Thank you. You mentioned Vice President Pence and his assistants recently. The New York Times reported over the weekend that at one stage you were asked or told that if you wanted federal government help to get swabs, that you would have to ask President Trump himself and to thank him. My question is, was that the first and the only time you've ever gotten such a directive from the White House to personally request aid from the president, whether it was regard to the COVID emergencies or wildfire assistance? And did you think that that was an appropriate request?
The better question was, is it true? The answer is it's not true. So the answer to your second and third question, or 2 questions, is that no one told me that. No one asked me that. So never came to me. There may have been a conversation, but it certainly didn't come to me. And to the extent that we were able to procure those swabs, we were grateful, and I expressed gratitude, but no one told me to express it. I'm very consistent. Anybody that's watching this, anybody that's willing to help this state, I'm going to express deep gratitude for that help, and I appreciate you acknowledging that we have acknowledged the Vice President's help, specifically as it relates to 190 personnel. We continue to need more support. We need a national strategy, not just support here in the state. This nation needs more support on testing at a national level, and we continue to need more support on our efforts to contact trace, isolate, and quarantine individuals, and we certainly look forward to be able to complement those efforts if and when they materialize.
Sophia Balog, SACB.
Hi, Governor. Your administration initially said that for counties to get those attestations to reopen more quickly than the rest of the state, that they would need at least 15 contact tracers for every 100,000 residents. We reported last week that at least 17 of the counties that secured those attestations did not meet that threshold when they submitted their documentation. So I'm wondering, why did your administration decide to let them reopen without meeting that threshold? And are you planning to handle that threshold differently next time if, indeed numbers go back down and you're faced with a similar situation where counties want to reopen more quickly? Will you be handling that piece of it differently next time?
Yeah, it's a wonderful opportunity because Dr. Galley and I were having a very robust conversation about this 2 hours ago. He's here, and he is principally on the front lines of this issue and this question, so better get it directly from the source.
Thank you, Governor. Indeed, when we rolled out our attestation process, we asked counties to demonstrate a number of different things, and one of them was around contact tracing. We asked them to be able to demonstrate the capability and have a plan to build up to 15 per 100,000 residents in their county, and each of those counties did that. They were not required to have them identified, named at the moment. We knew that we were building up our contact tracing program, that we at that time had a lower number of cases being reported.
You've been watching Governor Newsom's coronavirus update. He has a few new numbers for us. Just yesterday, July 19th, he says that there have been 6,846 positive cases. He also says there has been an increase, a slight one, 16% in hospitalizations. But in that same time frame, which is a 14-day period, he says the positivity rate is actually held at about 7.4%. And while that may seem stable right now, he says that could all change depending on our behavior. And it's our decisions that really affect whether this state will reopen. Again, you can go to kpix.com.